Hi, Katie. Just doing my hip eval, casual. All right. Okay. Hi, I'm Kayla. I'm Carly. Nice to meet you. Okay, so tell me what happened.
My hip hurts.
Okay, so what happened to your hip?
I don't really think anything happens. It's just like it's sore.
It's sore.
Yeah.
Okay. Have you been doing anything differently?
No. Like I lift a lot of weights but I haven't like changed anything.
Okay. How long has this pain been going on for?
Probably like 2 weeks.
2 weeks. Okay. Has it been getting worse, better?
It's about the same.
Same.
Pretty much.
Okay. Do you hear any like clicking or popping whenever you lift weights, going into squats or anything?
Well, I don't, but I listen to my music really, really loud. So.
Okay. Yeah. So then, have you changed like any surface or like changing your surface?
I got a new pair of lifting shoes.
Shoes? Okay, that might be it. What about your menstrual cycle? Is it regular?
Yeah, it's pretty regular.
Regular. Okay. Okay, so we'll go through some tests to try to figure out what's wrong with your hip. Okay. All right. So then after we do some history, we're gonna do some observation. So I'm gonna ask you to stand up, please. All right. Put your hands on your hips. Okay. We are looking for her ASIS to look and see if they're aligned. They look pretty good. And then if we turn around, we can see her PSISs. Okay, they look pretty good. And we're looking for coxa. If you turn back around, coxa valga, coxa vera, which is coxa valga is an increased angle in the hip. Coxa vera is a decreased angle in the hip. Also, we're going to look for if her toes go in, which is anteroverted, or toes out, which is retroverted. If she lays on the table, we can check and see her leg length. We're going to look at her medial malleoli, check and see they look pretty even. If we bring her legs all the way up on the table, making sure her toes are even, we can see from right here to check her femur and see if one's longer than the other. From the side view, we can see if her tibia is longer than the other one. Now, you can stand back up and we'll do some palpation. Okay, so right here we have her ASISs, her iliac crest. If we feel right here and have her move her leg, her greater trochanter. We have her VMO right here. We have her vastus medialis, rectus femoris, rectus intermedius, and vastus lateralis. And along the side, we also have her IT band that runs right along here. In the back, if we look at her hamstrings, we have her biceps femoris and her semimembranosus and semitendinosus. And then you can also check the femur and see if you can feel deep in there on the bone. Okay, so now we are going to do some neuro. We're going to check your neuro. So you're going to sit back on the table. Okay, we're going to check for myotomes and dermatomes. So dermatomes, we're going to check for feelings and sensations. You're going to check bilaterally after you've done the feeling of the muscles to see if there's any pain anywhere. So this is L1, L2, and L3 bilaterally, L4, L5 all the way down the middle, and L4 was to the big toe, L5 is down the middle of the tibia, and then S1 we go along the side of the calf and to the toe, the pinky toe, and then all the way back up is S2. And now we're going to check the myotomes, muscle. Okay. This is L1 and L2 if she brings her leg up and I'm resisting. And then this is L3. She's bringing her leg into full extension and I'm resisting. L4, she's going to bring her foot into dorsiflexion. L5 is her big toe extension. S1 is pushing down into plantar flexion. And then bringing her knee back into flexion is S2. And we're doing this bilaterally, and you can also check her reflexes. So L2 through L5 is going to be her patella tendon, so you just get a nice little whack there, and then she has great reflexes. And then S1 and S2 is the back, the Achilles, and her foot should go down, just like that, perfect. Checking bilaterally. All right, now we're going to move to range of motion. So we're going to have you stand up. All right, we are going to do her flexion of her hip. So she's gonna bring her leg all the way up. We're gonna check both sides. This should be around 120 to 130. You can check with a godiometer, it's usually measured. And then next, we can do both sides. Next we'll do extension. When she brings her leg all the way back, that should be around 10 to 20. And then we are going to do internal and external rotation. So she's gonna sit back on the table. This is internal rotation, and we're measuring this, and then this would be external rotation. All right, and internal is probably gonna be around 45, so this will be 45 degrees, and this will be probably 50 right here. And then we can do her abduction and adduction. So if she lays all the way back on the table, she's gonna move her leg as far as she can all the way out, and this is abduction, and that should be around 45 degrees right there. And then if she flips over on her side, she is gonna bring her leg up right here, and this is abduction. She's gonna bring her leg all the way up as high as she can go, and that's usually around 30. Okay, so now that she's on her stomach, we're gonna start going into manual muscle testing. So if we're testing her, could be her glutes right here. We have the, this is her gluteus maximus right here. She's gonna bring her leg all the way up into extension. All right, and then if you come back, turn around, we'll have you do your medius and minimus on the side, bringing her leg all the way up. And then on the table, we'll do your iliopsoas, scoot all the way up. We'll have her leg come up. This is her iliopsoas. We can also do her, we'll do her quads, sorry. Okay, if we bring her foot into internal rotation, we're testing her vastus lateralis, and she's gonna push out, and I'm gonna resist her into full extension. In the middle, we have her rectus femoris and her vastus intermedius, and she's gonna keep her foot in neutral and push out. And if her foot, and if her foot is in external rotation, we're checking her vastus medialis, and she's gonna push out in flexion, or extension, sorry. And then if she flips over, we can do, sorry, I'm gonna get bruises. We're gonna do her hamstrings. Okay, so if the foot is internally rotating, we are checking her semimembranosus and semitendinosus, and she's gonna pull her foot all the way back to her butt with resist. Go ahead, there we go. And then if it's externally, we're checking her biceps femoris. Pull in, there we go. All right. Now that we've done all the manual muscle tests, we are going to do some special tests. Yeah. So we're going to start with the Fabers and Patrick's, which will test for if there's a hip pathology. So what you're going to do is you're going to lay on your back, so it's just supine, and we're going to make a figure 4 on both sides. So we're going to cross over just like that. You're going to have one hand on the ASIS and the other pushing down on the knee, and if there's any pain, which her face indicates there's pain, we have a hip pathology. And we can also do it both sides to check and see what side we have the pain on. Yep, there's hip pathology there. All right, if we move down to hip scoring, we can have the knee flexed, bring it up here, and what you're going to do is you're going to apply pressure, and you're going to externally and internally rotate the leg. So just like this, and we're listening for like clicking or popping or locking, sorry, and there's going to be pain along there. You can do it up here as well, just different ranges of motion to test to see. That could indicate a labral tear or OCD in the femur or the acetabulum. Next we can do the piriformis test, which is when you lay on your unaffected side, so lay on whatever side. All right, so you're gonna bring your leg up right here. This one's straight, okay? And we're gonna push down, holding onto her hip, pushing down to her knee. And if there is tightness there, then we'll have piriformis tightness, just like the test says. So her leg didn't go too far down, so she might have some tightness. All right, the next one we have is Thomas test. So you're gonna sit on the edge of the table. Okay, so I want you to stand up, and you're gonna bring your knee to your chest. We're going to test both sides. You're going to rock all the way back, the leg comes off the table, like kind of what we saw, we have the iliopsoas tightness. If it goes into leg extension, kind of like this, we have the rectus femoris tightness. And if it goes out to the side, we will have an IT band tightness. Yeah. All right. Now we're gonna do the Eli's test, which is when you're on your stomach. Oh, goodness. Okay. So we're gonna bring her leg all the way up, and bring it all the way up to her butt, right here. And if this hip raises off the table right here, we would notice it. You can also do it on both sides. And this is rectus femoris tightness. See how this one kind of came off? It's kind of hard to see, but that would be indicating rectus femoris tightness. And the last one we have is Trendelenburg. I can never say that word. Trendelenburg, which is you're going to stand off the table. Okay, so you're going to stand on the unaffected side, and you're going to bring hands on the hips, bring one leg up, and if her leg drops, it would indicate gluteus medius weakness. So if it kind of rocks down, gluteus medius weakness. I believe I did all the special tests, so that would indicate that she has some hip problems. Thank you, Carly, and thanks, Katy.